नमस्कार, सत श्री अकाल, आदाब, गुड मॉर्निंग, गुड आफ्टरनून एंड गुड इवनिंग जहां से भी आप हमें सुन रहे हैं. थैंक यू फॉर जॉइनिंग आवर लाइव सेशन. माय नेम इज कुंजन मवार. हमें आपके होस्ट और दोस्त फॉर टुडेज सेशन. E-Global Doctors Digital Health Hospital, connecting patients across the globe to doctors all over the world. In today's live session, we will be exploring and providing more information about oncology radiation and myths associated with oncology radiation in conversation with Dr. Dodul Mondal. Dr. Dodul, his specialty includes radiation oncologist, comprehensive cancer care, clinical oncology, cancer screening, genetic screening, cancer diagnosis, and treatment. Dr. Dodul has contributed, author of multiple national and international textbooks. It's really nice to meet you again, Dr. Dodul, virtually. Thank you for sparing. How are you doing today?
I'm great, Kunjan, and thank you for this nice introduction. And thanks, E-Global Doctors, for again giving me this opportunity to be here.
Thank you, Doctor. The pleasure is always ours. I know that I learn a lot when you come, and I'm sure our listeners and viewers are going to agree with us. So with that, let's dive into today's topic, and I'm going to ask the first question. Does radiation therapy for cancer treatment always causes hair loss?
A very nice question. And to begin with, I must say that I like this idea of myth busting because there are a lot of misconceptions in people's mind regarding radiation. So many a times in my practice, I have seen that those misconceptions actually deter people from getting the necessary treatment. So it's really, really important. So to begin with, whether radiation always causes hair loss, right? No, radiation does not necessarily always cause hair loss. It all depends on the site of radiation, the amount of dose we are giving to kill a tumor, how far the tumor situated from the area of hair, and the kind of technique of radiation, the kind of machine using to treat the radiation. And in today's time, the sophisticated radiation machine and technology gives us the opportunity to spare hair in many situations from the bad effect of radiation. Occasionally, there might be some temporary hair loss, and very rarely there can be permanent hair loss.
Okay, so the good news is no, it does not cause a hair loss, and even if some hair are lost, it's only temporary and they'll come back, which is very comforting to know. So thank you for busting the myth right there. My next question to you is, can radiation therapy make cancer spread or become more aggressive?
Not at all. So radiation is the treatment which can cure tumor. Now you know that something which cures tumor will not cause spreading of the tumor inside the body. So radiation does not spread cancer inside body. It cures the tumor.
That's wonderful. So you guys, we busted two myths right here for you all. And it's very comforting. And I'm sure whoever is going through these treatment, they would be very comforted as well with the myths that we are busting. The third one is, can radiation therapy cause permanent damage to any healthy tissues?
So to bust this myth, there has to be some understanding that many a times when we treat a tumor with radiation and we try to kill it, we need to give pretty high dose of radiation. Now, at the immediate vicinity of that tumor, some normal tissues might get significant dose of radiation and cause significant permanent damage. But then the normal healthy tissues have immense capability to regenerate and regrow most of the time. So with time, most of them actually regrow to their original self. It's only in a very, very small percentage of patients when we can expect that the permanent damage may be there in and around the tumor after radiation. But that percentage of patients are really, really very, very low. And with time nowadays, we are getting even more advanced form of radiation, which are allowing us to treat the tumor with very high dose and safeguarding the surrounding normal cells. So to answer this question, it does not always cause permanent damage, significant permanent damage to normal healthy cells. But on a very rare occasion, it can cause, and then it becomes more important to understand what kind of significant normal organs we are having in and around the tumor, and how to treat them using more and more advanced machine and technology.
That's actually good to know. So the answer is yes and no. So no, they don't actually cause damage to healthy tissues. And even if they do, the tissues will actually come back to its original state after some time. So is it true that radiation is always painful and uncomfortable?
No, not at all. Radiation is never ever painful. So radiation itself is a painless process. It's just like the sun rays falling on our skin and we don't feel any pain or heat or cold. Radiation is basically high energy. Most of the time it's high energy X-ray or some particle. So when they enter our body, they do not cause any pain, they do not cause any significant heat or cold, or they do not cause any heat or cold at all. But what happens with gradual passage of time and gradual accumulation of radiation dose in our body, it shows some side effects, like some reaction on the skin, and people erroneously perceive that as radiation causing heat or cold or radiation causing the pain. So the answer is radiation per se does not cause any pain. It's a absolutely painless treatment.
Wonderful to know. So we are busting the myths about radiation. So I hope you guys are getting loads of knowledge. I know that I've asked 4 questions and we have busted 4 myths. My next question to you, Dr. Dodul, is can radiation therapy cause long-term side effects such as higher risk of developing another type of cancer?
So to bust the myth, most of the time it does not. So the risk of radiation causing a cancer is very, very less. The literature says it's mostly somewhere around 1%, but then there is a different group of population, right? It's more common in uh, young and so it's in childhood cancers or children, the young adults, patients who are getting radiation in and around the breast area, chest area, and who are having some kind of genetic problems in their DNA, which makes the cells of the body more sensitive to radiation. So those are the population or the group of patients who can have higher risk of cancer arising out of the effect of radiation. But that risk is really, really very less. And then again, I will reiterate this fact that nowadays we are having even more advanced technologies like particle beam radiations, which reduce this risk even further. So the dictum says wherever the particle beam therapy is available and the patient is a kid or young adult, they should be offered this treatment so that the effect of radiation to cause a second cancer becomes even less and lesser. So the answer, straightforward way, it does not always cause a second cancer, but there is a small risk that in future, like around 10, 12 years after the initial radiation or 15, 20 years after the radiation, it might lead to another malignancies.
Okay. Perfect. Good to know. So right now we busted 5 myths for you guys and it's looking very promising. So I just wanted to let you know that we are live on Facebook, YouTube, Twitter, LinkedIn. Please hop on your social favorite media platform where we bring new and exciting, interesting topics for you. eGlobal Pharmacy can deliver prescription medicines to any part of USA. Yes, you heard it right. Any part of USA. And eGlobal Pharmacy can deliver prescription medicines within 15% of discount to any part of India. So it doesn't matter where you live, eGlobal Pharmacy has your back. If you are joining us, we are in conversation with Dr. Dodul about the myths. We are busting the myths about oncology radiation. So the next question I want to ask is, can radiation therapy be used to cure all types of cancers?
So most the answer is yes, radiation therapy can be used to cure most of the cancers. Now we need to understand that radiation therapy alone may not be the solution. So we call it comprehensive cancer care. Most of the cancers need radiation, surgery, and some kind of systemic therapy until and unless it's a very, very early stage tumor where it can be cured either with surgery or radiation. So the answer is radiation will be needed for most of the cancer patients in their lifetime as part of their treatment. And that percentage may be around 70 to 80% depending on different countries, the stage, the cancer type. But most of the time, it's part of the entire treatment regime, right?
Okay, perfect. That's good to know. So, is it true that radiation therapy is only used as the last resort when the other treatment have failed?
Absolutely no, absolutely no. There are so many cancers where radiation therapy is the solution and it itself can cure the tumor without needing any other treatment. And we definitely use radiation even at the last stage of cancer to provide symptomatic relief or to avoid some significant permanent damage happening or arising out of the tumor. But most of the time, radiation in advanced stage or end stage or last stage of the cancer are given for symptomatic relief. Now, radiation can cure the tumor in many situations. Like I would like to tell you one very typical or very common cancer, which is very common worldwide, like vocal cord cancer, the larynx cancer, or we can say that the cancer of voice box. So in stage one, like T1 or T2 tumor, radiation itself can cure that tumor without needing surgery. So you got the answer.
Yes, that's actually, I did not know that, but that's amazing. So, certain cancers can be cured just by radiation, using the radiation techniques. That's good to know. And I did not know that there is a cancer related to the voice. So, that's another information
Yes,
that I got
there
today.
can be a cancer from each and every part of our body. No cells or no part or no organ is immune to cancer.
That's and well, that's good to know. See, I always tell you that I learn a loads whenever you are here. So we
Oh,
are
that's so
busting the
amazing.
myth.
Thank you so much.
Thank you. So we are busting the myth, and we are actually at the same time, Dr. Dodul is educating us. So my next myth busting question for you is: can radiation therapy be used to treat cancer that has spread to other parts of the body?
Yes, as I was saying you, like when a cancer spreads to other parts of the body, we call it in general terms, we call it a stage 4 cancer. Now, in stage 4 cancers, radiation can be used to give symptomatic relief. Say, for example, a tumor has spread to bone, causing significant pain, or to brain, causing some difficulties or problems like weakness, unconsciousness, like all these problems. So radiation can be given to provide symptomatic relief and save life in many situations like that. Now, one promising role of radiation in even stage 4 cancers I would like to highlight is there is a small subset of patients where we see that the tumor has spread out of the organ of origin, but
Mm-hmm.
the number of tumors outside the primary organs are very, very less. So we can give very high dose of radiation to those tumors, and we call it ablative radiation or stereotactic body radiation therapy. So we can cure some of those stage 4 cancers as well with radiation. And mostly we see these things in case of lung cancer spreading to, say, for example, liver, or lung cancer spreading to some bones, or lung cancer spreading to brain, like that. But the number of spread, or we call it metastasis, has to be very, very limited and small in size. So radiation not only provides palliation or symptomatic relief in last stage of cancer, but in some of those situations, it can actually help in getting rid of the cancer as well.
So that's actually really good to know. So can radiation therapy cause infertility? Gender neutral question. This is both. This is like a question for both in men and female.
Yes, so I would not say that's a myth. It's a
Okay.
reality. And radiation, high dose of radiation given in and around the uh, glands like testes in male and ovaries in female or uterus in female. So if the dose are not well controlled, then radiation can lead to infertility. And any person willing to preserve fertility, needing radiation, must discuss this with their treating radiation oncologist and an infertility specialist so that they guide together how to tackle this problem. So in many situations, we actually encourage the patients to go for either sperm preservation, sperm banking, or ovum preservation, or ovarian cortical stripping, or something like that. So it's an important issue, and I must appreciate that you brought this issue in discussion. So infertility in patients getting radiation. So most of the time we are afraid when the patient gets radiation in and around the pelvis that this might
Mhm.
lead to infertility. We discuss this and we try to find out some options how to preserve the fertility.
So that's actually good to know. So yes, the answer is yes, it could affect the fertility or it could cause infertility, but there are options to work around. So you get the radiation and you also preserve the other thing that we were discussing. So is it possible to receive too much radiation during a treatment, like getting too much exposed? If you can shed some light on that.
Again, a very good question, and I would say that uh, depending on what kind of tumor we are treating, we decide the dose of radiation. So the part of the tumor or the part of the body having the tumor definitely gets high dose of radiation, and that's like significantly high dose of radiation compared to what a normal person in an otherwise situation is supposed to get in their lifetime. So it can be million times higher than the tolerance for any normal person. But when a person is coming to us with a tumor, that limit is not there, because now our purpose of giving radiation is different. And now we try to cure the tumor and we want to kill the tumor cells. So we need to give high dose of radiation to the tumor. But we have gadgets, we have technologies, we have our training and understanding to know how to save rest of the body. That becomes more important. So it's not about the question is not about whether we get or the patient gets high dose of radiation. It's more about how to safeguard the rest of the body from the effect of high dose of radiation. And there are different mechanisms in the machine, in the treatment room to safeguard the patient and the bystanders. So yes, it definitely gives high dose of radiation inside body.
Okay, perfect. So, viewers and listeners, it's very important. Talk to your oncologist, have a good understanding of what you're going to be going through, and then decide the best course of action. So, if you are joining us, we are in conversation with Dr. Dodul about the myths about oncology radiation, and we are busting them left and right, which is actually a very good news. So, eGlobal Pharmacy can deliver prescription medicines to any part of USA, and eGlobal Pharmacy can deliver prescription medicines within 15% discounts to any part of India. So, it doesn't matter where you are, USA or India, eGlobal Pharmacy has your back. My next question about busting the myth about radiation. Radiation therapy always causes skin ulcer. Is that a correct statement?
No, not at all. It very, very rarely can cause skin ulcer if the technology is poor, or if the machine is very old, someone is having a tumor very close to the skin, where actually we need to give the entire dose to the skin and the tumor. So most of the time it does not cause ulcer. But I have seen in my practice that many patients actually do not follow the instructions explain to them how to save the skin, how to follow skin care during radiation. That might lead to ulceration. So it's not the radiation per se causing ulcer. Many a times it's not actually following the instruction which leads to ulcer formation.
So always listen to your doctor. If they tell you take care of your skin, please take care of their skin.
Yes.
You know, we all need a shoulder to blame. So, it's radiation taking the heat all the time, but that's not the case. Dr. Dodal just mentioned. So radiation causes harm to other members of the family. Is that true?
Not at all, not at all. So we have advanced machines, technologies, and nowadays, whenever we talk about radiation, so I'm talking mostly about the uh, therapeutic radiation or external beam radiation. Now, there is a
Mm-hmm.
different form of radiation which mostly the nuclear medicine experts use for treating some kind of cancers like thyroid cancer, where actually they give some kind of radioactive material inside their body, and that radioactive material can emit radiation for some time. So, other than those few specific situations, the machines which are used to give radiation to kill cancer cells are actually a kind of switch on, switch off phenomenon. So you switch on the machine, radiation starts coming out from the machine. You switch off it, and then there is no more radiation, not in the machine, not in the treatment room, and not at all in the patient's body. So the patient can safely go back home, sit, eat together, cuddle the kids. There is no harm. But if someone is getting some radioactive treatment, like I said, like radioiodine treatment, then the
Mm-hmm.
patient needs to discuss with the treating physician about the policies or about the safety measures they should follow once they are back home, like
Okay.
staying away from kids, staying away from pregnant ladies, like that. And I
Okay.
think most of the time the physician should inform that.
Okay, wonderful. So the short answer is no, it will not cause harm to any other of your family member. Like doctor mentioned, you can go back and live your life as every single day, but it's always important to consult the person giving you a radiation treatment. So it's not safe to go out in the sun while getting a radiation. Is that a true statement or false?
I would say that's not true. So radiation does have nothing to do with sun exposure, but sun exposure can lead to sweating, can lead to dehydration, and if the person is not well rehydrated, that can lead to other problems. But the kind of radiation we use for treating cancers have nothing to do with sun exposure.
Okay, so another myth busted. Sun has nothing to do with you going out in the sun or getting a radiation treatment. Radiation therapy is used only for treating cancer. Is that true or false?
No, again, it's a myth. Many a times we use radiation to treat non-cancerous tumors, and that's a pretty common situation in most of the radiation centers where we see or we treat non-cancerous conditions like some thick scar, we call it keloid, some benign tumors which are not cancers, like some small tumors of pituitary gland, like that.
Or
So
fibroids? Can fibroids use
no, so
radiation as well?
we do not treat fibroids with radiation. Most of the time, the fibroids causing symptoms will require a surgical removal.
Yeah.
And so the answer is radiation is not only used to treat cancer cells or cancerous tumors. Many a times we use it for treating non-cancerous tumors as well.
Okay, so that's wonderful to know. Radiation therapy is not used for cancer only. Like doctor said, if there is something which is benign, which is not cancerous, radiation can also actually fix that. So that's actually wonderful to know. We were busting all the myths for you guys for related to oncology radiation. Let me tell you real quick. eGlobal Doctors Digital Health Hospital is offering consultation services from the comfort of your home. Benefits. What are the benefits of booking a consultation with eGlobal Doctors? Same day consultation with the specialist doctor. 2 free diet sessions are included. The package is $199. And if you're listening, you can save 15%. The coupon code for 15% is FIRST15. FIRST15. 24/7 customer support service available, health education videos for high BP problems, and free health passport for 1 year. what else you want, all you have to do is hop on to eglobaldoctors.com and book your consultation today. So I don't see any more questions, so I think it's a wrap. So, Dr. Dodul, if you don't mind, can you quickly summarize the myth that we busted around the oncology radiation for us?
It was a great experience once again to interact with you and busting the myths. So, to summarize, I would say that most of the conceptions or most of the myths running in the society are actually and factually they're incorrect. The patient must discuss with the treating radiation oncologist to know which is a fact and which is a myth. There is no other alternative solution to this.
That's actually a wonderful knowledge share that you just did. Please don't be your own doctor. We have specialists and subject matter experts for a reason. So do consult with them and stop making assumptions by yourself. So that's a wonderful keep tip. So eGlobal Doctor is one complete healthcare platform solutions for all your medical issues and questions. And maze ki baat hai that these services are available to you at your fingertips without breaking your bank, without even driving at the comfort of your living room. All you need is your fingers and your smartphone, and you are done. So before I let you go, Dr. Dodul, any word of wisdom that you want to share with our listeners and viewers?
Radiation is one of the strongest weapon to win against cancer. It should be used judiciously, meticulously, and properly. Always discuss with your treating radiation oncologist to know the nitty-gritties, the technical details, and do's and don'ts during radiation. That's it.
Thank you. Well, there you have it. This is RJ Kunjan signing off. Sayonara. Till we meet again, stay tuned, stay safe, and keep smiling always. Thank you, Doctor.